Emily Elizabeth, what a neat name you have. My husband's fond of double names, and it's not often people go by their double name. Thank you for sharing with me. You've answered questions and spoke of things that help me to understand you and how you've been struggling. You shared that you tried an antidepressant in the past some time ago, but it didn't do any good, so you said, and so you just stopped it. You also said that you feel you'll always feel this way. May I talk to you about combination therapy? And by that, I mean treating your depression with medication along with talk therapy. I would like to speak to you how this may be helpful. Then I'd like to discuss how talk therapy is more than just talk. It has an effect on your brain, just as medication has an effect on your brain. The brain is like a relay station sending messages. Medication affects the brain by increasing chemicals called neurotransmitters. These neurotransmitters are found between neurons, and neurons are brain circuits, and the neurotransmitters help the message to transfer. There are several neurotransmitters that send messages of well-being, joy, and happiness. Medication increases the neurotransmitters. Different medications affect different neurotransmitters. Some patients respond to one medication better than another. I'm sure we'll be able to find a medication that is helpful for you. Now, regarding talk therapy, there are many studies of clients who only took medication. Others of clients who only participated in talk therapy, and then those with clients who did both. And the studies which looked at clients who did both consistently have shown people who've utilized both medication and talk therapy had better results. Their mood improved. The reason for this is known because medication and talk therapy affect the brain differently. I just mentioned that medication affects the brain chemicals by allowing the transfer of messages. Talk therapy affects the routing of the circuitry itself. Circuitry being like wires, like electrical wires. It was thought that once thought that brain circuits, once they were routed, that the routing couldn't be changed. But now it's known that brain circuits are like a soft plastic that can be molded and rerouted. This cannot be addressed by medication. Rather, it's only addressed through human interaction. And to give you kind of an example, through interactions of infants and toddlers with persons who are kind and loving, the child develops a sense of love and trust and feelings of joy and well-being. It's known that infants who are not nurtured in this way appear depressed. They do not smile or reach out for connection with others because this communication wasn't established by a trusting person. This is where the brain circuitry begins. How the brain starts making connections, one neuron or wire to another neuron. When a child is taken into a nurturing environment, a child that was not nurtured, and they develop a relationship with someone who's loving and provides for the needs of this child, the child's circuits are indeed rerouted. Mind you, I'm not saying that depression always goes back to childhood. I'm just explaining to you the circuitry of the brain. Now we are able to see through special MRIs that areas of the brain that are responsible for our emotions, they become more active during talk therapy. There's stimulation in this area of the brain. When combined with medication, which increases the neurotransmitters, which helps the transfer of the message from one neuron or one circuit to the next one in line, Talk therapy actually helps to reroute the circuits such that better messages are sent. So we know that people who have both talk therapy and medication, depression is improved, messages of peace, well-being, and happiness begin to be transmitted. Research has also shown that some clients might improve with just medication, and you probably know someone who has taken an antidepressant and it improved their depression. Some clients will do well with talk therapy and not need medication. This might be a client who's experienced a traumatic episode, but they don't have a history of significant depression. And through talk therapy, they're able to put this episode in its place. They're able to work through the feelings that accompanied this episode, and through talk therapy, this is improved. We could say it's like talking to your BFF, Something happens, you're upset, you talk to your BFF, and you feel better. But if you can't talk to them, you just can't get past this event. Well, there are times that we need a little bit more guidance into insight, and there's things that you might not want to share with other people. I would hope that you would come to trust that you can really share anything with me. You don't have to guard me. So there's also people who've had serious depression in the past, and maybe people who have tried medication in the past. Those people respond better to both talk therapy and medication, and they respond better than either one of them alone. Since you reported to me that you felt depressed for years and you didn't feel like you were ever going to be better, sometimes you felt worse, sometimes you felt some better, and that you tried medications that didn't seem helpful, I think you fall into the group of people who have the best response to medication plus talk therapy. May I share with you how you approach talk therapy? You mentioned that you were interested when I mentioned therapy a few minutes ago. You know that I'm a nurse practitioner. Earlier you called me a doctor, remember, and I said, no, I'm a nurse practitioner. Well, generally the public sees a provider who can order tests and write prescriptions as a doctor. That's common. People say that all the time. May I tell you, I can do both. I think that people are aware that nurse practitioners can write prescriptions, but I'm also trained in talk therapy. You may be familiar with psychologists and social workers or different people who are therapists. But as a psychiatric nurse practitioner, I have been trained in talk therapy. So, nurses approach patients in very different ways, and we have different ways to assist patients in improving their health. Nurses look at the total patient and how the condition they're experiencing is affecting not just their body, not just their emotions, but their whole life. And from hearing you talk, yeah, depression's affected your whole life. You feel like you've been in situations and you wanted to be happy and you couldn't feel happy and you're having trouble sleeping, and sometimes you don't have any appetite, which bothers you. Sometimes you feel like, I just want to eat something that makes me feel better. Well, nurses look at the total patient. Physicians, you called me a doctor, physicians, they are trained to understand diseases and to treat diseases. And this leads to my approach to talk therapy. First, may I say that depression and other mental health issues are a behavior and mental health condition. A condition is a state of health that interferes with usual activities or feelings of well-being. Depression affects the way you feel, the way you think, your participation in activity, and your body, like fatigue, inability to sleep, and tearfulness. I choose not to look at mental health conditions as diseases. I would ask you to begin to think of depression as a condition. Patients generally think doctors write prescriptions and that fixes diseases. This is often true, but not always so with mental health conditions. Clients as yourself, working with a therapist during talk therapy, will learn things, pardon, you know how technology is. Yes, it is so frustrating. Technology is frustrating. Here we go. I'm sorry for that interruption. So I'd like you to begin to think of depression as a condition. And clients such as yourself, when they're working with a therapist during talk therapy, they will learn things that they can do to improve their mental health. They can learn things that they can do that helps their depression, that helps their anxiety. And I would like to partner with you to help improve your depression. Second, this has to do with my philosophy, how I think about talk therapy. I want to tell you that nursing research has looked at patients and nurses and found what is good about the relationship between them. People see nurses as more than people who do things like start IVs or give medications. Rather, people would usually say that a nurse took care of me or that nurse cared for me. Patients have a sense they have a relationship with a nurse. Indeed, nursing is called the caring profession. That is because this is what we do. We care for patients. One of the first psychiatric nurses identified that the nurse-patient relationship in itself brings healing to patients. Nursing's not just a job for me. Nursing is what I am. I have a deep love of caring for patients. It's been present since I began my career. In fact, I decided probably was thinking in the 7th grade that I wanted to be a nurse, and in my senior year in high school, I knew I wanted to be a nurse, and I've never wanted to be anything else. And as a nurse practitioner, I've always been drawn to the emotional pain people feel. Been a nurse practitioner, a family nurse practitioner, your regular nurse practitioner for 20 years. And patients have told me that helping to relieve that pain changed their life. I've now become a psychiatric nurse practitioner so I can devote my energy to help patients with mental health conditions and help them to achieve a higher state of wellness. Emily Elizabeth, if you would choose, I'd like to be the one person who both prescribes your medication and leads you in talk therapy. Through the relationship we develop, I hope you'll further your trust in me. And I would like to say again that I appreciate the trust you've already shown in me and continue to share pieces of your story that may have led to the depression, how the depression has affected your sense of well-being and its impact on your activities and how it affects your body. As we talk, I'll be able to tell if the medication is being effective. Also, through listening to your life story, I would like to help you see and choose things that you can do to relieve your depression. I want to tell you, Emily, the ability to feel better, it lies within you. I just want to help assist you in using the power that's already present in yourself. I want you to give that a little bit of thought. And after you've made a consideration, we'll talk about your medication. We'll talk about starting talk therapy. I have medication that I would like you to start if that's what you would choose to do today. I want to tell you that a relationship with a psychiatric provider is different. And I mentioned the partnership. Informed consent, because it is a partnership, I want you to feel like I've always informed you of what I'm considering, what type of medication that I'm going to recommend, how this medication, what the side effects you may have, and as well during talk therapy, I will make suggestions of activities you can do, ways you can change your thinking, as well as to help you interpret maybe some of your life experiences. And I appreciate you coming in today. I know it took a lot of courage, and I certainly appreciate it.